Hi, my name's Dr. Sanjay from Trick One Aesthetics Mayfair, and today I'm here to talk to you about PRP. So PRP stands for platelet-rich plasma, and it's a treatment that's been around for a long time and it's used to treat many different indications. So the most common ones are going to be things like the vampire facelift, which you might see marketed around, which has been around for a while. However, the indication that I'm going to talk about more so in this video is for hair restoration and regeneration of your hair follicles. So in terms of PRP and the way that it works, essentially we start off by taking a blood test, almost like when you go to the hospital and you take some blood, like any other time, and with that blood it's then placed into a centrifuge. So this here is the centrifuge, and the way that it works is it spins the blood around really quickly for about 10 minutes. And the difference between different types of PRPs out there is all down to do with how long it spins for, the speed that it spins for, and there's different evidence bases to suggest that at certain frequencies you get a better quantity or quality of the platelet-rich plasma, which is the bit that we're really interested in for the regeneration. So in terms of the process with this, after we've taken some blood and spun it around, the blood separates into lots of different layers. And the one that we're interested in, the platelet-rich plasma, is then withdrawn out into different syringes, and then that is re-injected into the target area. So in the case for a patient where the main concern is hair loss, when we inject the plasma into the hair follicles, the hope for that is that we're going to stimulate some regeneration of the hair follicles, which helps the hair regenerate. In terms of who's a good candidate for this, unfortunately, when you've got cases of complete hair loss, or where you've got areas where there are no hair follicles whatsoever with baldness, this isn't something that's going to recreate or make new hair follicles that no longer exist. This is more for something such as when we've got thinning hair, or where we've got an area where you're first starting to notice the signs of hair loss. For a patient, most commonly it's going to be something like if you're brushing your hair and you're noticing when you look at your comb there's going to be a bit of hair in the comb, and if that starts to increase over time and you start to get a bit concerned that, okay, am I starting to notice the first signs of hair loss, this is a really good time to consider PRP, because you're going to have the first initial response of knowing, even after about 3 to 4 weeks, when you repeat that process, hopefully the hair loss in the comb is going to stop because your hair is thickening and you're going to be having less hair loss afterwards. Then you're going to notice over time your hair is going to thicken and it's going to start to regenerate. So in terms of this type of treatment, generally it's a course of treatments, so anywhere from 3 to 6 courses, and they're spanned about 3 to 6 weeks apart depending on the patient's time frame as well, but 3 to 6 weeks apart or so. After this there'll be some maintenance courses, which are going to be more like every 6 months or so, or 3 to 6 months. It depends on the quantity of hair loss that the patient's got. But after this, it is something that we're going to want to have to repeat over a period of time, because with hair loss, it is something that happens to certain people for a variety of reasons. So the most significant is going to be a genetic component. So when we've got someone like this, there are other things that we can consider too. For example, oral medication, topical creams, along with the PRP, and they all work together. One of the main reasons why PRP is a really good option is actually the evidence base behind it, which we're actually going to have linked in below within the video. So in 2020 there was a systematic review that was comparing the impact of PRP on hair loss with other modalities, and it found that there was an 83% improvement in patients who were using the PRP with regards to noticing regeneration of their hair, which is very significant. And in 2019 there was a study that was directly comparing PRP with minoxidil, which is another common treatment for hair loss, and the conclusions for the study was that PRP was actually a superior method of treating the hair loss. So the beauty of PRP is fundamentally it's a very safe treatment, because we're using patients' own blood and constituents within their blood. From there we're pulling out all the growth factors that are going to be really beneficial, and we're tapping into the regenerative capacity of the stem cells. So using this we can get more stimulation and more proliferation of different types of cells. We can get thickening of the skin, we can get the hair follicles kind of speeding up in how they work, and all of these are going to give positive effects on the face, the body, the skin and hair, depending on how you want to use it. So one of the nice things about this treatment is it's not very painful, and that's very good for these patients because essentially the process is we do add a lot of numbing into the area and the scalp for about half an hour or so, and by the time we get to doing the injections we're using a really tiny needle, so it's lots of little scratches almost, and it's over very quickly, so the discomfort level is quite low for the procedure. So in terms of side effects and complications for the procedure, it's really minimal. So as I mentioned before, because we're using your own blood, this isn't something that people typically have a bad reaction and adverse response to, so it's very safe from that point of view. With regards to after treatment and aftercare and the downtime, it's minimal. I mean, it's a case of kind of mild irritation to the scalp for a day or two with a little bit of redness as it's kind of just healing itself from the tiny injections. Generally speaking, whenever you're doing an injectable treatment, the rule of thumb is you say there can be bruising and swelling for 1 to 2 weeks. Having said that, with something like PRP, it's going to be more on the short end of that scale because things are going to be looking pretty much back to normal, more like after 2 to 3 days. So the downtime for it is minimal. In terms of the actual specific aftercare for the treatment, you obviously need to be careful with things like washing your hair, so just don't do that for 2 to 3 days because you don't want to irritate the area after it's been injected. But beyond that, there isn't too much that you really need to worry about, but a full list of what to do post-treatment will always be discussed with your doctor. Another common question is, what's the difference between a surgical hair transplant and PRP for hair? So really it's more so down to patient selection. With certain people, clearly they might need a hair transplant more so because the hair follicles are completely gone and there's nothing there to really stimulate, and for these people, PRP would be a complete waste of time. Having said that, for someone who still has hair follicles and it's more hair thinning that they're noticing and it's earlier on within the process, PRP is a non-surgical intervention, so given that it's non-surgical, the downtime's a lot less, the result's going to be a little bit smoother for the patient because they don't have to go through a surgery, but fundamentally it's down to patient selection because one's going to be more suitable for one type of person and the other's going to be more suitable for the other. Another thing that's important to bear in mind is even after somebody has had a hair transplant, PRP is very common as part of the aftercare at either 3 monthly or 6 monthly intervals just for hair maintenance. Thank you very much for watching. I hope you've enjoyed the video. We have also made another video to discuss PRP and its indications for the face and for skin regeneration, so please do take a look at that if it's something you're interested in. Thank you very much.